Okay, all you badass soul-seeking warrior listeners out there, I'm happy to have Dr. Heather Saran as my guest today. Dr. Saran is the founder of Bright Endocrinology, which is the first direct care endocrinology practice in Scottsdale, Arizona. She attended medical school at Midwestern University's Arizona College of Osteopathic Medicine in Glendale, Arizona. She then completed a residency in internal medicine at the prestigious Cleveland Clinic, and then following that completed a fellowship in endocrinology, diabetes, and metabolism at The Ohio State University. Her philosophy centers on viewing each patient as an individual and partnering with each patient to develop comprehensive evidence-based treatment plans. Her treatment approach emphasizes preventive treatment, which I love hearing that. And thank you to Dr. Saran for carving out some time with us today. Welcome.
Thank you. Thank you for having me. I'm also very
Welcome.
impressed you got my last name right, and we didn't even talk about that before.
I did a little research and I listened to some of your YouTube very informative conversations you've had with others.
So you were the
Anyway,
one person who watched my YouTube channel.
yeah, I did. I learned a lot from it. So first of all, I want to congratulate you for starting your own practice. I know in medical school you might get 35 seconds of education on becoming a business owner. And so it is no easy task to dive into wanting to do your own thing and business. And that brings me to what inspired you to specialize in endocrinology? Because
So
there's a
my,
lot to choose from when you go to medical school. There's a lot of places you can go. Why did you
yeah.
choose this?
So it wasn't a straight path. I think it's important that, we evolve, your interests change. So when I was um, going to college, I wasn't pre-med at all. I wasn't even thinking about becoming a doctor.
Oh,
My original plan was to become a dietitian. So I went to ASU, Arizona State, and pursued a bachelor's degree in nutrition sciences. And about halfway through, I decided to switch and look more seriously into becoming a doctor. There's not like a pre-med major, so I still completed my nutrition major, but I always had a passion for eating healthy, in healthcare. So I think that gives me a unique advantage having that background. Um, and at some point I thought maybe I wanted to be a cardiologist. In order to do either specialty, cardiology, endocrinology, or any of the other kind of organs in the middle of your body, you have to do internal medicine first. So I went to Cleveland Clinic, which is known for its cardiology program, and completed internal medicine. And while I was there, I realized that I was not meant to be a cardiologist. Um, I love the science behind it, but the everything felt so rushed. There were so many patients. There was no personal time. I'm someone who wants a little bit of balance in my life and not just live at the hospital. So I pivoted, and that was tough. Thinking about being a cardiologist had been part of my identity, for the last part of medical school and internship. Um, and then I realized, endocrinology was really probably a better fit for me, having that nutrition background and how that affects so much of our endocrine and hormone systems. And it's great, especially in this practice, being more direct care or concierge. I have more time to connect with people. I can really get deeper into, what are their habits, what's their lifestyle like. So having that nutrition background has really been important in educating my patients.
that is such a great segue into a question that I want to ask you and for you to share with our listeners. And it's about Ozempic.
hmm
What are your thoughts about it? What are some of the potential side effects? Who's the ideal patient? Who isn't an ideal patient? What are some of the long-term effects? I know we don't have a lot of research under our belt yet because it's a fairly new treatment for weight loss. So let's start with the Ozempic conversation.
So Ozempic is relatively new. Um, Let me see if I can find, I should have had this opened, some more specific examples. But the predecessor, the original GLP-1 medicine, was Byetta. And that was That came out, I believe, 20 years ago, over 20 years ago, maybe in 2004, something like that. And so this type of medicine has been on the market, but it hasn't been so mainstream. So all these, different medicines, Ozempic, whether you call it Wegovy for weight loss, diabetes, um, sorry, Wegovy would be for weight loss, diabetes would be Ozempic. They've been on the market for a long time. And so now that they're more mainstream, if there are any possible side effects, now we have more evidence for things like that. Um, but if anything, the more the research has come out has shown more benefits. So now these medicines are FDA approved for things like weight loss, cardiovascular disease protection, um, chronic kidney disease. It can slow the progression of people with kidney problems, and even treating sleep apnea. And one of the latest is about, they keep changing the name of it for simpler terms, fatty liver. But now the FDA says we can use these type of medicines, Ozempic, for that. Um, and I'm going back. Oh, okay. So that original medicine Byetta was 2005. I finally found my notes on this. Um, and then Ozempic came out in 2017. So this has been around for 8 years, and there were other medicines on the market for diabetes, for that too. So it keeps evolving. So that original one, Byetta, used to be a twice a day drug. Then it became once a day, and now once a week. And there's other things in the pipeline where we might be looking at medications once a month or something like that.
Okay. And is there, um, in your experience with folks that you've worked with, are there any side effects to be concerned about using Ozempic? And I'm talking, I know it's focused on diabetes, but I know a lot of folks are using it for weight loss these days.
Yeah, so if we're talking about for weight loss, the most common side effects are going to be GI, like an upset stomach. A lot of times people will have a little bit of nausea, maybe some heartburn, sometimes diarrhea, but I'd say constipation is more common just the way the medicine works. It's slowing down the gut, things aren't moving through as quickly. A lot of times those side effects get a little bit better the longer you're on the medicine. The body kind of builds up a tolerance to that. Sometimes as the tolerance to the side effects goes away, sometimes the weight loss can slow down as well too. So when a patient has to then increase their dose, sometimes we see those side effects will come back, as the dose increases. And again, usually after maybe two weeks of shots, that usually goes away. There are some people who can't handle one drug, but they may do better on a different drug like tirzepatide, for weight loss. There's also Saxenda, which isn't used as commonly anymore since it's a daily injection. Um, so those would be the most common things, usually nothing too serious. Occasionally people will become, dehydrated. That does have the potential for some kidney impairment, which is usually temporary. Um, some of the more serious side effects, it does carry a risk for pancreatitis. However, a lot of the newer data is a little bit mixed. Some studies say that it doesn't have that. So I think that's one that's still kind of to be determined. We will see gallstones being more common, but that can happen with any type of weight loss. It's not unique to Ozempic, whether people are doing it with good old-fashioned diet and exercise, or it's pretty common in the bariatric population, people having weight loss surgery. They're kind of, again, a rapid weight loss. They're more likely to develop gallstones. And then there's a lot of confusion around like a black box warning about a rare type of thyroid cancer. So if you've ever read the fine print, it says, there's a risk for medullary thyroid cancer. Don't take it if you or anyone in the family has a history of that. And this comes from that original drug Byetta when they were studying that. It was done in rats, not in humans. So if you were a rat, I would not recommend taking these medications.
Okay, good to know.
But the rat thyroid is made up of different types of cells in the human thyroid. So this rare type of thyroid cancer, medullary thyroid cancer, develops in what's called the C cells. Humans have a few of those, but not very many. But that's kind of the majority of the rat thyroid. And again, when they do these studies, they're giving rats these mega, super physiological doses to kind of bring out those side effects. We've never seen that in humans, so there's rumors that may fall off the label in the future.
And does one have to take this the rest of their lives? Where's the stopping point, if there is one?
So I think that's in an individualized thing for people who really suffer from, chronic morbid obesity. There are benefits. We do view it as kind of a lifetime medication. So there's the a phase of weight loss followed by a maintenance phase. So for some people, if they come off, they're just going to gain it back. So all the data that we have doesn't have any long-term safety concerns that someone could be on these medicines indefinitely if it's helping to control their weight and preventing the future, possible complications that go with obesity. If you think about heart disease, cancer, inflammatory processes. Um, there are some people who get to their goal weight, and if someone's doing okay, again, sometimes we maintain, sometimes people want to come off of it. A lot of it's cost if it's not covered by insurance. Some of it's just cumbersome having to do injections. So I have had some people who have successfully weaned off and been able to maintain it. I have a lot of people who maybe maintain it kind of like a micro dose. Um, but there is pretty good data showing that if people do completely stop it, the majority of people will gain some weight back, not necessarily all of it, but some of it.
Is there an ideal patient? I'm guessing someone who's obese or morbidly obese or does have cardiac challenges that their weight's, perpetuating even more concerns around that. I'm supposing that someone that has maybe 20, 30 pounds to lose may not be as good of a candidate. It is
Right.
that
So, I mean, there's what the FDA says is a candidate. So, if you're obese, defined as a BMI of 30, or if you're overweight with some of those other problems, the sleep apnea, diabetes, the fatty liver, those are reasons to be on it. They've made some of the guidelines a little bit more vague. Instead of having a BMI criteria, they just say overweight. And so I think that leaves some interpretation up, to the prescriber. There are people if, they would benefit from losing 20, 30 pounds or not necessarily morbidly obese. I do think it has a place for that. I've had some people say, I've only been on this for a couple weeks. I've lost a couple pounds, nothing major, but I already feel so much better. Like, why do I feel better even if my weight, hasn't moved that much? And so usually if people are getting a pound a week, they've been on it for 2 weeks, that's great. But is 2 pounds going to change much in the way you feel in terms of the stress on your body? Probably not, but the way the medicine works is it's also regulating the hormones, so the gut hormones, incretins, insulin, and that is also involved in your inflammation. So in theory, people are probably experiencing, a sudden decrease in the inflammatory response, the way that this is controlling insulin and other gut hormones.
got it. That's another great segue into let's talk about hormones next. So hormones can feel like a mystery to a lot of men and women. Can you give us a simple layman's explanation of what role that the hormones play and in how we feel both physically and emotionally?
Yeah, so when people say hormones, a lot of times they're talking about reproductive hormones, estrogen or testosterone. As an endocrinologist, there are so many hormones that people don't recognize. There's thyroid hormone that's controlling your metabolism. It's got a role in all parts of your body. There's your parathyroid hormone, which is mostly controlling your calcium and your bones. There's your cortisol, that's your stress hormone. But if we're talking reproductive hormones, then that's a little bit more nuanced. So younger women who are still in their reproductive years, if they're not on, any type of birth control or things like that, and their hormones are naturally cycling, then there's always fluctuations. And sometimes that's hard to, appreciate what's the underlying cause or where I'm in my cycle. Or, for like me, I have a progesterone IUD where I don't get a period, so I never know where I am in my cycle. But I work with a lot of people in, some women who have type 1 diabetes, and they'll notice that their blood sugars fluctuate throughout their cycle, and that can be kind of a clue where maybe they have to adjust their settings or how much insulin they take off that. Um, but estrogen plays a role in all parts of our body. So perimenopause is a hot topic right now. And people always think of hot flashes when they think about menopause. That's kind of the classic thing. But before women start having hot flashes, a lot of things what they'll notice is even, if there's fluctuations in the estrogen, there's less to the brain, that they just can't think as clearly. They may not feel like themselves. I was trying to film a little Instagram video for that. And while I was doing it, I was like, what am I trying to say? There were three topics I was trying to hit, and I had to film it multiple times. It was so ironic. I couldn't remember the third thing.
Can
How
you
hard
just
is
put
the
that
third
in your
thing?
videos? Like I'm a perfect example of what's going on with that right now, right?
Right. I mean, I think we all have, why did I walk into the closet?
Yes,
Why am I
yes,
here? Even myself, I've noticed sometimes you're searching for that word,
right.
what am I trying to say? Um, and so those are things where you're just like, am I getting older? And yeah, that can be an early sign, or people just not feeling like themselves. That can, a lot of times impair relationships. It can make it kind of a struggle, with a romantic partner, children. Some people just say they feel a little bit more on edge. Um, and even before the hot flashes start, some people may sleep fine and then other nights they don't, and these hormones can just be unpredictable. It's not following the typical patterns that you used to be, if you're someone who tracks your cycles. So a lot of times if we're doing labs, sometimes they'll come back and they'll look normal, but if people are having symptoms, then I like to repeat them about 10 days later. So we may have just caught them, in an upswing, and we kind of have to catch the downswing. But a lot of it is symptom based. When we define menopause, it's, you have to go a year without periods. But if women, again, aren't having periods, how would I know if I'm in menopause or not? Sometimes we do have to rely on those labs.
Got it. So let's talk about hormone replacement therapy. What are some of the myths or misconceptions about that we could clear up for some of the folks out there?
I think a lot of people are concerned, especially women, about the risks for breast cancer or for clotting. Um, And their hormone replacement used to be popular until the 90s. There was a big study that came out called the Women's Health Initiative, or the WHI. And that was showing higher rates of breast cancer, higher rates of stroke. Um, but you have to look at the way the study was designed. It wasn't a group of women who were, 45 to 55 going through perimenopause, menopause, transitioning, to hormones. It was mostly on average older women, people who had been through menopause a decade or two before. So they are naturally kind of at higher risk for having breast cancer or having strokes. And then introducing hormones, we do see that there is a risk in that older population who's, gone decades without and then put on hormones. Also, the type of hormones they used is different from what we use now. So the type and the amount of hormone has evolved over time. Even birth control used to be, really high amounts, then it was lower. Now we've kind of met somewhere in the middle. There's also a lot more options out there these days. So
Mhm.
sometimes when someone says, "Oh, I couldn't tolerate, birth control when I was, in my younger years," what we're using for menopausal or perimenopausal hormone replacement is much lower than what's in birth control pills. Sometimes this is trial and error, but I try and reassure women that these are not the mega doses they were getting when they were in their 20s, especially if that was, 30 years ago. That this is much different. It's a little more nuanced in how we do it. And I think it's really kind of an individualized decision, on how you move forward. We're also lucky that now there's some non-hormonal options for some of the symptoms of menopause. Um, and then, I don't know if it's one of your questions later, but there's also options for local, like vaginal estrogen for women who maybe are at higher risk, a history of breast cancer, stroke, blood clots. If they're experiencing any, vulval vaginal symptoms, UTIs, vaginal dryness, pain with intercourse, having a topical of vaginal estrogen is still a viable option because almost none of it gets absorbed into the system. So it's not putting them at higher risk for those other side effects.
Got it. And do you have insights, traditional pharmaceutical hormones versus compounded bioidentical hormone replacement therapy?
I mean, I think that has to be individualized. I think there's a lot of good marketing for things that are, natural or bioidentical. There are certainly things you can get at the pharmacy that are bioidentical, but I think compounding kind of markets to people who are looking for something kind of in the natural realm. It's not necessarily better. A lot of times insurance won't cover compounding things, so there can be extra cost associated with that. Um, Compounding does give you a little bit more control if people are really sensitive to hormones. You can control it outside of what kind of the rigid doses that are just, available. Um, I will typically opt for patches for my patients for estrogen, just because anything topical is going to bypass the liver metabolism and decrease your risk. So a lot of compoundings will offer topical kind of creams or gels, um, or sometimes a troche, like a little lozenge that goes below the tongue. And
Mhm.
that's getting absorbed sublingually. You're not necessarily swallowing it and going through the gut. So compounding does have those advantages as well.
And you've worked with a lot of, particularly women, going through these different transitions from perimenopausal to right in the middle of menopause to postmenopausal. Are there any patterns that you've noticed that hold women back from truly feeling their best? Do they not start soon enough, or they don't educate themselves? They don't go to the proper doctor. Maybe they're not going to a specialist. Are there any patterns or trends that you notice?
I think as a population as a whole, we're still kind of scared of hormones from that study
Yeah.
that, came out 20, 30 years ago. And even the education that the majority of doctors are receiving is extremely limited in terms of menopause and hormone replacement therapy for men. Um, Even my education was, I would say, lacking that I went through. I'd say I got more education on testosterone, hypogonadism for men than I did for women. Um, and I used to always, earlier in my career, refer to OB-GYN thinking they had all the training in this hormone replacement therapy. And I've talked to my colleagues and they didn't get a lot of it either. So the people who are doing the work on menopause are either probably fresh new grads as this becomes less stigmatized, people are learning a little bit more about this, or people like me and my OB-GYN colleagues who have just made it a point. We're always doing continuing education, as physicians, one, it's a requirement, two, things evolve. And so I've put more of my focus into learning more about perimenopause and menopause replacement because there's definitely a lack. There's a need for that. So I think together we're kind of shifting, the mindset for people. And I see a lot of it on social media of trying to take away, those barriers. There's websites you can go online. There's, Menopause Society, ACOG, American College of Gynecology. They have resources where you can find a provider who specializes in menopause.
It's interesting. I never had this occur. I just yesterday went to for my annual checkup, and my physician, a female physician, asked me, she says, I have some mental health questions for you. And I thought, oh my gosh, I was excited that,
Yeah.
this actually came up. And she went through, have you felt sad lately? Are you feeling bad about yourself? A whole series of questions, which I had no concerns with, but I was really glad that that was coming up. So, how have you noticed that of men and women, but particularly women's emotional health can affect their hormonal health? How do those two tie in together?
I mean, I think there's a lot of interplay. So sometimes it's the question, is it the chicken or the egg? Again, these things fluctuate, so it's hard to get, specific data on that. But certainly we do know that, in women, as hormone levels fluctuate, that they may have more kind of depression, there's the, perimenstrual, dysphoria disorder, which is basically, depression around the time of your period, or usually it's the week leading up to the period when hormone levels, really dip. Some people can be very sensitive to that. And there are specific pharmacological medication that's available for women who are afflicted by that. I think historically, women's symptoms kind of just get brushed under the rug. People just say, "Oh, you're being hormonal," or just a woman. So now I think we have a better understanding that that is real. It is something to identify and treat. With men, a lot of times if their testosterone is low, they'll also feel kind of down or depressed as
Mhm.
well. So we will see, improvements in mood for men who are truly low, and then we replace their testosterone back to normal levels. We're all probably fairly familiar if men get too much. I see a lot of people kind of falling prey to maybe men's clinics where, based off symptoms, they're getting put on testosterone. They may not necessarily truly be low, and then they have these super physiologic levels. And then that's where we see, more of the roid rage that you've probably heard of. It can kind of swing things from just like feeling back to even keel, to being a little bit more explosive.
And so, what are some practical things that both men and women, and once again, particularly women, can do to support their endocrine system? You do a lot of preventive medicine and a lot of preventive techniques, and so I'm curious what you would suggest would be some of those more practical, holistic things we can do.
I think a lot of it comes down to like the basics. Like I wish there was like a magic pill or supplement you could take and it would make things better. Um, I think now we're also learning more about the importance of sleep, of getting, not just 8 hours, but high quality sleep. Limiting things like alcohol or marijuana before bed, so you're truly hitting kind of that deep sleep or those REM cycles, which may be limited, if there's any substances in our system. Stress management, so cortisol will play a role in this. If you've ever been through a period of high stress and not gotten your period that month, that was your cortisol telling your body, we are not in the proper state to reproduce. Let's shut this system down. And so cortisol and people's level of stress definitely plays a role. So anything we can do to manage stress, whether it's, deep breathing, exercise, mindfulness, meditation, that can help kind of keep the hormones a little bit more in check as well.
With your background in nutrition, which is unusual for physicians, oftentimes in medical school, I don't know that you get a whole lot of nutritional education. I'm sure it's touched on. Talk to us about the importance of nutrition and what is a suggested, in your experience, eating plan that people can follow that will help with some of these endocrine type symptom or endocrine support that they can do for themselves. I think personally, in my experience, I'm not a doctor. I'm far from a doctor, but my experience is that food can be one of the most powerful drugs that exist.
Certainly, yes. I mean, I think if people are eating a well-rounded diet, we don't necessarily need a bunch of supplements. So I've touched on this, but I think there's probably a lot of marketing. There's money for people to gain, kind of preying on people's needs for replacement. But if you're really eating, a balanced diet, you shouldn't necessarily have to take any, nutritional supplements in terms of vitamins, things like that. Um, it's hard to say on like a whole what's the best. I treat a lot of people with diabetes, so if you have type 2 diabetes, a lot of times we need to limit your carbs. So that may mean more protein. And there can be a balance because if people are getting their protein from animal sources, that can also increase your cholesterol intake. And often high cholesterol also goes hand in hand in people with type 2 diabetes. So there's a trade-off there. If people can get more plant-based protein, I think that's probably a healthier route for people. The only diet we really have good evidence-based studies on is the Mediterranean diet in terms of heart health. Also, people hypertension, there's some data about the DASH diet, which is low salt. We don't have any data saying that, oh, the keto diet is better for you or paleo is better for you. Not to say it's bad for you, we just don't have the science-driven data. So I think people just have to figure out what works well for them. I see a lot of people with thyroid disorders, and a lot of them tend to be gluten sensitive, not necessarily celiac where they have a true allergy. I think some people might be a carrier where they'll test negative, but they're certainly sensitive to it. So sometimes it's just trial and error. So it's not necessarily going to harm you in terms of, taking your medication, it's going to throw up your labs. But if people are coming to me saying, hey, I'm bloated, I've got this joint pain, sometimes, okay, let's cut out the gluten for a month and see if it helps.
And how valuable are our lab results in kind of not dictating, but driving the direction we should go nutritionally? Can we use those results and say, okay, whatever, I'm low on this, or it looks like I have some thyroid things that are popping up, or other things that they might show on those lab results. Does that help us to determine the best eating plan for ourselves?
That's a tough one to answer. Your routine labs aren't going to test all your vitamins and nutrient levels, but we certainly can get clues. So one of the main things we'll see with like a basic blood count that's in most kind of standard lab work, a CBC, we can tell if someone's anemic or not. But often those labs may come back normal, but people could still have a borderline nutritional deficiency. So sometimes if people are coming to me with specific symptoms, even if that's normal, we have to dive a little bit deeper just to see if maybe they have an iron deficiency or maybe they are taking that multivitamin, but their body can't absorb it. So sometimes we have to do further testing to see if there's any issues where even though they're getting what they need, their body just can't utilize it.
And is there suggested blood panel or lab panel that patients could, say to their doctor, these are the tests I would like to have done? And is there at some point, is it important to get like a baseline where you do a really comprehensive blood panel where you check all kinds of different things?
I'm not a big fan of checking everything because if you check everything, you're always going to find something that's wrong. And a lot of it is nothing you need to worry about. If you get a bunch of blood tests, there's always going to be something that pops up. I see people panic because it pops up red. You see your lab results and it's in bold. And it's a decimal two or point off. And I think sometimes that can cause more anxiety than it can really help. Um, like I said, just kind of routine lab tests may miss some of that stuff. So I think working with a provider who can really individualize things to you, where you don't have to go down every single rabbit hole, but that can help focus, where there's areas for improvement. Um, so I have a lot of colleagues who are great doctors and they can't do these assessments in your standard 15-minute appointment that you would have. So if people are really invested in their health, a lot of times they do have to find another direct care or concierge doctor. And especially if you're looking for something like that, people who are doing integrative medicine or functional medicine, they're the ones who are going to be able to dive deeper. And I think, advocating for yourself, is important too. I don't always love it when people come in convinced they need something done, you know, because Dr. Google probably told them they had something, but they don't really understand kind of the full picture. So I think bringing your symptoms forward or making suggestions, you know, is important, but I don't think a lot of doctors like it when patients are kind of demanding certain tests, be done.
Well, I think too, it's important for we as the patient to communicate everything to our doctor, as small as it might seem to us, a symptom or something that's concerning to them, and not feel embarrassed about it or not feel that it's not something the doctor wants to hear. Because I would guess the more information you have, the better.
Yeah, absolutely. And, when I see a new patient, I have an hour to sit down with them. When I was at my last practice in the traditional insurance-based system, I had, up to 30 minutes. but that included all the time to, review the charts, to document everything, to order the labs, to finish typing my note, to doing the billing. So even that, 30 minutes, maybe, 10 of that was actually spent, in front of the patient. And it's a great point what you made, because even just yesterday, I had someone in and she has multiple health concerns, and she came in being like, I don't want to bother you with all these health problems. I want to try and focus on what we're here from. And I was like, well, can you let me know? It could be related. And, she was talking about how she had chronic diarrhea, and it was embarrassing for her to discuss. But as we got into that and she'd seen GI, she'd had, a big workup from their end, but there can be hormonal or neuroendocrine causes for chronic diarrhea, especially unexplained. And so, I don't have the results back yet. I saw her yesterday, but certainly letting your doctor know of things that may seem unrelated, may help kind of tie a diagnosis together.
Right. Okay, I want to switch gears here for a few minutes. I noticed you're wearing an Aura ring, and I think
Yes,
I saw you had an Apple Watch on. What
yes.
role does technology, or what role can it play in our health system, our personal health kind of understanding and knowledge? And does that technology help a physician? I'm guessing it would. But what do you think about the Aura ring and the Apple Watch and some of these other technology based opportunities that exist today?
You're very observant. But I mean, I think knowledge is power. If we can understand kind of how our bodies, adapt, and with the Aura ring, they have kind of their algorithm, so it can kind of give you some insights or suggestions. So I mostly wear it to track sleep, to see, okay, if I exercise, did I sleep better or worse? I'm not a morning person and I have small kids, so a lot of times my exercise is later at night, and sometimes I sleep better, but I'm going to bed later, so I'm not getting as much of it, but I'll still see that, I got better quality sleep in the same amount of time. My sleep score isn't, really that much different, but I will see the differences in, heart rate and the way that, plays out overnight. And they have like their heart rate variability index. Or if I didn't exercise and say I was snacking, it'll say, oh, your heart rate was higher. Were you eating last night? I'm like, oh, yeah, I was. I was.
Gotcha, gotcha.
Yeah, and as a doctor, I can't tell you how many people have come in with thyroid problems and they have an overactive thyroid and they only knew because their watch was telling them their heart rate was too high. It wasn't necessarily, it can catch like AFib. It wasn't arrhythmia. It wasn't abnormal. It was just going too fast. And I've had patients show up with graphs of we didn't treat their thyroid, and you can watch their heart rate, go back to normal as the medicine kind of kicks in. So I think it is a useful tool, and it's something that I'll document, in my notes if the patient's, reporting what the heart rate is. They can pull it up an app, they print off the graph. I find it helpful.
I think it is useful because without some of those gadgets, we wouldn't necessarily know that our sleep was really terrible. And we wouldn't necessarily know that when we ate popcorn and have a beer at 9 o'clock at night, it
Yeah.
changes things around and spikes maybe our insulin and those kinds of things. So I think if one has the opportunity to look into those, that it might be worthwhile for sure.
I don't
Um,
think everyone needs to wear one, but if
right,
you're someone looking to make changes who can take that information and actually adapt to it, then it's beneficial. If you're going to keep having your beer and popcorn at night and not change
right.
anything,
Why bother? Yeah.
yeah, save your money.
Yeah, I think for me, and I'm just one person in the billions on this planet, but I really have practiced for the majority of my life to be real self-aware, to really quiet myself enough to, if I feel like my heart beats a little stronger, if I feel a little stressed, to get to the underlying that. What is that? Was that a conversation I had? Was that something I ate? Was it something that I was upset and I didn't get enough exercise that day? Do I need to just drop everything and go out in nature and take my shoes off and walk on the grass for 15 minutes? Those
Hmm.
things. So
Yeah,
I love technology, and I don't think it's necessary for everyone, but it's a useful tool in the appropriate at the appropriate times for sure.
great.
Um, few more things here before I let you go. I know you have patients that you need to get to here in a few minutes, but if you could share one message with women and men, but particularly women again, who feel a little off or unheard when it comes to their health, what would you say? What would you suggest to them?
I think finding a physician that you can really partner with in trust is really important. You know, especially women, I think historically we get kind of brushed off or, seen as hormonal. And if you're working with a doctor who, again, just has that couple minutes with you in the exam room, you're probably not going to have time to address it. I know it may not be affordable for everyone, but finding, someone you trust, if you can get someone who's concierge or direct care and has more time to dedicate to you and tailoring it to you, not just, okay, check, 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 that's where you can really make kind of the most meaningful impact in diving deeper. And sometimes people just need reassurance. Sometimes we'll do all the tests and we don't find anything. Sometimes I think people have undiagnosed mental health, issues. And maybe they felt stigmatized. And so sometimes treating some underlying depression or anxiety can help with that too. Um, and so I think just removing the stigma from these things. Is it hormones? Is it mental health? And having a physician that you can partner with, I think is best rather than feeling like the relationship is one-sided.
Yeah, I think, your relationship with your physician is not unlike your relationship with your spouse or a partner or boyfriend or girlfriend. You have to have a certain level of communication and honesty and integrity about that and trust that
Right.
they are listening to you and they care what you have to say and they're really, allowing you to speak. And when that trust is developed, then you are more willing to be vulnerable and more honest about what's going on with yourself. So it's a huge and a very important relationship for sure. Okay. One last thing before I let you go here. What's next for you? Do you have any upcoming research that you're doing or additions to your practice or books that you might be thinking about writing? What do you got? What do you got for us?
Right now, I'm still working on expanding my practice. So I've been open for a little bit over a year, but I'm still taking new patients. Eventually, I need to make t sure I have enough time for all my patients. So eventually, I will have to cap the amount of people that I see. There's always some flux in that. So, if we have a wait list, then people will be moving in and out. But I started kind of putting together a plan of maybe expanding locations if there's enough demand. If I get capped, bringing on someone else who's like-minded. Um, I have no plans to write a book, but if you would have asked me, 2 or 3 years ago, did I plan to open my own practice? The answer was no. So, like I said in the beginning, things always change. I haven't stayed on, a straight line with my career. I think it's important that, we grow and we expand. And I looked into maybe putting together, a longevity program and things like that. And some of it involved some of the wearables and whatnot. But at this point, I don't think it financially, made sense or seemed to interest a lot of my patients. But the direction I'm going in is more preventative rather than, just putting a band-aid on something that's already there. So, while I treat people for, type 2 diabetes, it's still in the early stages, but I'm putting together kind of a program for people with pre-diabetes or maybe a family history of diabetes and how we can prevent that.
Very good. Well, I commend you for all that you're doing. And so, all of you listeners out there, I know that you got some value out of this conversation today. Anyone living in the Scottsdale area of Arizona, if you're looking for a good physician, you have one right here in Dr. Heather Saran. So, thanks for your time today. And one last question is there something that I could have asked you that I didn't know to ask you that might be helpful or useful for our listeners as we wrap it up today?
Well, one of the things, you said if you're in Scottsdale, I actually see people across the entire state.
Okay.
So I already have a lot of people who may live in Glendale. I have some of my old patients. I mostly worked in Chandler. They're traveling from Maricopa to come see me. But one of the things we recently launched was like our telehealth program.
Okay, good.
So a lot of times I like to meet people in person the first time. I like them to come to the office and kind of feel the
Sure.
vibe that we have. So a lot of times I get people driving up from Prescott, or sorry, down from Prescott, up from Tucson for their first visit. But a lot of what we do, I'm not an orthopedic surgeon where I need to touch your knee, see how your hip's moving. And so many things are cloud-based. I can screen share your labs. I can download your insulin pump or your continuous glucose monitor from the cloud. So I am serving all of Arizona.
And I suppose neighboring states too, if they're willing to drive from California or New Mexico or Utah, wherever
Yeah, I
they
do
are.
have a couple of patients who live in California, but at this moment, I only have an Arizona medical license. Like I
Got
mentioned,
it.
I may look into expanding. So patients have to be physically present in Arizona. So I've had some people in New Mexico and they don't live far from the border. They'll just cross over, they'll drive over and they're in their car and I'm talking to them. But at this point, you do have to be in Arizona.
Okay, great. Well, I'll continue to watch you closely. For all your listeners out there, I will put Dr. Saren's website address in the show notes. So if you're interested, you can go have a look at that. There are some very informative pieces of information on that. And as always, everyone, have a kick-ass rest of the day. Keep your ass in the saddle, and I'll talk to you really soon. Take good care. Bye for now.